Are you ready? You bet. I got it. I got it, y'all. 2024 is a new year. Happy New Year. And with 2024 being a new year, we have to share the updates. Yes, 2024 Ngn Nclex updates. 5 quick tips on how you can pass this test. Now, we know some things already. It came out last year. I've had a whole year to analyze thousands of students' performance on this brand new Ngn Nclex exam that came out in April last year. Let's just make sure we all know the basics, because you can't assume whether you're taking a test for the first time or you failed 10 times. This video is for you. Here we go. What do we already know? What did we know in April? We know that this test gives you partial credit, and it gives you partial credit not just on the select alls, but on even your case studies and everything else. Why does that matter? Because to be honest with you, it made the test passable. Literally, this test is something you can pass. So if you failed a million times before and you are scared to death to take it again, stop it. Put the fear on the back table. Get your butt up and let's go head on and try it again. This is your test to pass. All right, that's a big deal. Partial credit, right? What else did we know going into this in April last year? You can get as few as 85 questions and as many as 150. You knew that. That's old news. What else did we know going into the test last year? We knew that it was going to have a higher number of medications and a higher number of infectious diseases. Ooh, that's going to lead to some of the updates that I'm going to share with you today. So hopefully your crazy behind and already hit that subscribe button, and you know this is HETV, and I am Dr. Shelly, about to share some love. Here we go. First tip, because I told you there's 5 tips. 5 tips to passing this test, and they're all based on the updates that I have to share. Here we go. Number 1, software. If you're going to pass this test, this Ngn Nclex exam, the software that you're going to need to buy must have Ngn Nclex case studies on it. It must also have at least 2,000 questions in it, and it must be very difficult. What does that mean? Well, I have studied at least, and I counted them just so you know, because I've done consultations on all these students with all these students, and with that comes the knowledge on what are they doing on this new test. So what I have seen over thousands of students is that they are using the same tools. Almost 90% of students who have failed this exam have used the same tools. They all tell me they used Archer, at which point I kind of throw up in my mouth a little bit. It's not that Archer is bad. It's just too easy. I'm sorry, but that's my opinion, and it matters because I'm the one with the PhD. So I've looked at all of these software, and Archer is just too easy. Do people pass with Archer? Yes. Do people pass without anything? Yes. Would they might have passed without it? Probably, because it's too easy. So I don't get kickbacks. I told you before, it ain't nothing you world is paying me. I wouldn't take it if they was, because I believe in integrity. I ain't trying to be paid for my opinion, but my opinion, and it is an educated opinion, very educated opinion, because I done looked at it all, is that you world RN, even if you're an LPN, you world RN is the only software you should be messing with. Now, if you've done UWorld before, remember that your scores might be quite inflated. What that means is that you're used to UWorld questions. So it's not a bad thing. It just means that don't go too seriously by just that. Do more work than just questions, which is everything anyway. Everybody should be doing that anyway. So what are you striving to do? 500 questions a week. But you guys, what we now know is that you can't do 500 questions a week and make each day a 100 question test. No, no more than 5 to 25 questions. No more than 5 to 25 questions on one test. Keep it bite-sized so you can review the rationales and know what you're doing. You're going to review rationales on the questions you missed and the ones you got right. Because what if you got that question right because you guessed right? So always review the rationales. It's easy to review rationales on 5, 10, 15, 20, 25 questions. It's really hard to review rationales on an 85 question test. So stop doing all them questions. Keep it small, but do a lot of them. Always review the rationales. Some more tips on the software is that I need you to stop studying and stop spazzing and stop freaking out about math. I've been saying, I know you don't believe me, but ask my students. I've been saying for 20 years, don't do the math. Put 0 on the test for math. I literally say that. Why do I say that? Because I know, because I read, I know that the math can't fail you and the math can't pass you. Now with this new test, I have not seen much math at all. It wasn't even no math on the damn test. So why should I have you study math and cause yourself to get all up in a tizzy and get your panties in a bunch and your drawers in a crunch when you don't need math? So just kick that out your little thing. Get rid of math, okay? Now, don't be dingy. You gonna need that math later. Yes, you are. Not for nursing, because I haven't done a math question yet, and I've been a nurse almost 40 years. No, you're going to need that math to pass the math test at your new job. So I tell people, when you get that software, that UWorld RN software, soon as you pass that NCLEX, do the math questions on the UWorld software. Do those math questions, be ready for the math test at your new job. Because I've seen people fail that and then get their job that they wanted all their life taken away from them. And that is tragic because it didn't have to be that way. Okay, come on. Got shit to do. Now, I told y'all this was going to be based on updates. Here's the update. Whether you like it or not, here it is. The updates that I have seen in terms of what needs to happen for you to pass this test is the pre-assessments on Archer, UWorld, Cap, whatever. Those pre-assessments mean nothing. They say that if you get a 68, a 65, a 60, whatever, you've got a great chance of passing. Bullshit, not on this test. This test is easier because of case studies, but you still got all that other stuff from the old test that's still there. And because of that, we tell students that you need an 80 or 85% to pass this test. Now, if you're an LPN, you bump that down just a little bit, but not much. You bump that down to 70, 75% because you're using UWorld RN software. So you bump it on down. One of the reasons why I have the LPN use the RN software, let me tell you something, honey. LPN, UWorld don't have no EKGs on it, but that is an expectation. The little girl walked up in here yesterday to register for class. She was an LPN registering for LPN test, taking me for her NCLEX review. I had EKGs on my test. I'm glad you put them on the pre-assessment because I did have those. I know, baby. I know. Okay, so this is why the LPN UWorld is not adequate for the LPN. All right, we're going, we're moving. That was number 1. Let's go to number 2 because I told you 5. Number 2, every single student, now that I've had a chance to talk to all of you, every single one of you uses YouTube to study with, and that is amazingly wonderful. We didn't have that to study with. All we had was a library, a catalog drawer, and some big ass textbooks that would make you break your back carrying them everywhere. But you got your YouTube, so your cell phone is a library. Now, that's right, baby. Stay on that YouTube, but don't waste your time. I don't know if you found this to be true, but a lot of times you go on YouTube and you're searching and you find this one good video on this subject, then the next thing you know, some other video pop up on a whole nother subject. Oh no, that ain't how we roll. We got to be organized when we approach this test. We've got to do a really strategic view of YouTube. And I got to tell you, I'm good, but there's some more that are just as good. So let's look at that. First of all, we know my channel, HETV, stands for Health Education Television. HETV is organized by playlist. Here's how I want you to look at it. YouTube is your library. You go to the playlist, that's the textbook. Inside the playlist are videos, those are your chapters. So if you were to go to my HETV, go to the playlist and look for any subject, and it didn't matter which one. Maybe it's neuro, maybe it's GI, maybe it's cancer, maybe it's maternity, maybe it's peds, maybe it's cardio, maybe it's endocrine, maybe it's diabetes, maybe it's renal, maybe it's acid base, perhaps it's respiratory. It might be geriatrics or pediatrics. It doesn't matter. That's the name of the playlist. Psych, whatever. You tap that playlist, then you're going to see your chapters in your textbook. So if you tap on psych playlist, you're going to see chapter 1, personality disorders, chapter 2, depression, chapter 3, bipolar, chapter 4, schizophrenia, chapter 5, eating disorders, alcohol, all that is there, because you can't just know one video. You have to know that subject. So that's what I mean by organizing yourself. Now, like I said, I'm good, but I may not be necessarily the best. I do think I am, but I don't know necessarily because, it's a lot of shit out there. But let me tell you, yours truly, I'm generous. I love when I see quality work on YouTube. Let me tell you some other good channels. Other good channels on YouTube. Y'all know Mark is the bomb. You know Mark Klimek is the bomb. You know that Simple Nursing is the bomb. Those are good channels. You know that Level Up RN is the bomb. I don't know if you know if Registered Nurse RN or it's Registered Nurse RN. That's the bomb. I'm not selfish. There are so many good videos out there. You just have to make sure you're not all over the place. So when would I go to some of these other channels? Well, honestly, I have over 400 videos. I'm going to keep it real with you. I put my whole nursing school on YouTube. That's because I love you. I'm doing this as a ministry. No one puts over 400 videos on YouTube. No one does. No one puts an entire nursing school on YouTube. No one does. I did. It's there. And I still perfect the game because I'm never going to stop. I'm always going to be putting out videos. So what you're doing is you're trying to get a system. And let's say there is a program or something, a condition, a disease process. For whatever reason, you can't find it. Then you put it up in the search for YouTube and it pulls up some of these other good people. Watch it because they're good. All right, I hope I made myself clear. Now, no, I'm sorry for all you ADHD players because I get it. I got family members with it. It's not enough to watch the video. Look at this. Take notes. When you see a medication in the video, write that puppy down. And if you're using my products, go highlight it in the medication packet. Okay, so meds are huge. I just told you there's more meds on this test. So make sure you write down, like you have a whole section in your 5-subject notebook where you wrote down any medication we said in the video and any medication you saw on UWorld. Okay, highlight, use colored pens. You come in here with that boring ass black pencil or black pen and I'm gonna fuss because you're not really looking at this in a way that will make you remember it later. That's what the whole purpose of a highlighter and colored pens are. Get your shit together, girl. Go on shop in the Walmart and get you some shit to take notes with. You want your notes to stand out. You want to slap you upside the forehead when you open that folder. All right. Here we go. I told you 5 quick tips. Here go tip number 3. Tip number 3, based on the 2024 Ngn Nclex updates that I personally have seen, which is a whole year of watching the Ngn exam be taken by students. What have I noticed? What have we learned? Here we go. You definitely need more resources. You need to use your money wisely to purchase resources that make sense. You have told me, I already knew it, but you have told me that you have passed this NCLEX exam easily based on my pink packets. Some of you have even told me just the oh my God packet alone. I got a call from a student that used to be a student, I don't know, 10 years ago. She moved to Arizona. She called me as a nurse of 10 years for the pink packets. Now, come on now. You know the shit is gone. You know it's going to be the bomb. So here's what I'm telling you, all right? Your resources that you get, maximize your dollars. Some of you will do very wonderful, especially if you're a new graduate, you went to a good school. All you need is that. You just need the oh my God packet. That's it. You don't need no extracurricular crap, okay? But then again, some of you have failed. If you have failed, remember I told you, if you failed your test, you got to look at that candidate report. What did it say you failed in? Was it the number one subject that students always fail the NCLEX in? Was it basic care and comfort or reduction of risk? I'm sorry, but on this new Ngn Nclex, that reduction of risk, that oh my God packet, these two together, that basic care and comfort, when you look at this new test, this Ngn Nclex exam, after a year of looking at this test, you got to really know the same old thing you had to know on the last test, which was your basic care and comfort. But honestly, there is some news. Here's one of the updates that I have noticed. There are more procedures, which is another way of saying reduction of risk. So if you failed in reduction of risk or you failed in basic care and comfort, these two together, oh my God packet, reduction of risk, make up basic care and comfort and procedures that you got to know. The two of them together are a good purchase. You know that. I mean, that's just what it is. Okay, so whatever. Okay, a lot of you failed. And you know I said that this new Ngn Nclex has way, way, way more infectious diseases. And a lot of you failed that. This is part of the pink packets. We talk about pink packets all the time. We call it a pink packet bundle. You can check my link and get it. But you don't want to pay what's on the link because I am having a special. Some of you failed in the 20% of the test category. Now, if you don't know what 20% of this test is, for the LPN, it's coordination of care. For the RN, it's management of care. I put all of it in one packet. So if you were to get this management of care packet, you would be able to know ethical, legal, SBAR, workplace conflict, advanced directives, incompetence, torts, malpractice, negligence, fidelity, veracity, beneficence, all those terms, everything, therapeutic communication, non-therapeutic communication, everything is right in here. Okay, so that's 20%. Oh my God, delegation, everything. It's 20% of your test. Shit. Okay. Y'all know what it is. Some of y'all don't know nothing about EKGs. And I have such a wonderful video series under the EKG playlist that you can use to learn every EKG. I'll be teaching this in class in a week or so, and they're going to love it because they're going to see how in one day we learned a lot. Okay, you can teach EKGs in about one day. I mean, this is the bomb. Okay, so there's your EKGs. Now, what did we say? We said medications were increased on this new test. So you got medication categories. You've got pharmacology, which is an alphabetical list of all the meds. And then you've got this good old psych meds. And why do I have a psych meds packet all by itself? Well, first of all, psych is the only subject that is pulled out from every other subject, GI, neuro, renal, acid base, cardio, respiratory. Psych is the only subject that's pulled out by itself, separated, and given its own column on the NGN exam. When you get a report back, if you ever failed it, you'll see psych is separate and apart from everything else. Guess what? It's a huge focus on NCLEX. Guess what? Psych meds make up the majority of medications on this exam. What do I mean? I mean to tell you that 70% of the meds on this NGN exam are from psych packet. They're from the psych meds packet. They're psych meds. What makes up the other 30%? Cardio and GI. So you gotta know psych. You just have to. The meds are really hard. You gotta know the difference between benzodiazepines and antipsychotics and SSRIs and MAOIs. You just gotta, okay? So you, my love, are looking at the resources. You're spending your money wisely. And I just showed you, and I want you to see this. I just showed you the Oh My God packet. That was one. Reduction of risk procedures. That was 2. Infectious diseases. That was 3. Management of care. That was 4. EKGs. That was 5. Medication categories. That was 6. Pharmacology. Oh, by the way, that medication categories, brand new update, 2024, baby. Pharmacology, that is 7. Psych meds, that's 8. What am I gonna do for you? Oh, you know, I always have a deal at the end of my videos. Here we go. Pick 6 for 66. I will put a picture for this video. Pick 6 for $66 means you pick the ones you want. Everybody don't need that. Some of y'all already got the Oh My God packet, so you don't need it again. You might just want to pick 6 of the 6 you need for $66. And no, I don't have Zelle. Yes, I do have Cash App. And yes, I do have PayPal. Now you figure it out. All right, here we go. If the pink packets, and you see here it says deals, 6 for 66. If you are a new graduate or you only failed 1 or 2 times, the pink packets, that's probably all you need. But let's look at the student who failed quite a few times. Look at your risk factors. English, second language, failed 2 times or more. Well, I shouldn't say 2 times. No. Failed more than 2 times. Working more than 24 hours in a week, went to a bad school like in Florida, just saying, or they got more than 2 belows on their candidate report, or when they failed their test, they failed in 85 questions, because when you fail in 85 questions, you killed every patient. I can't even do CPR and revive them. Chest compressions don't even work. Don't nothing work because you killed them motherfuckers dead. Okay, yeah. If that's you, you might benefit from the entire self-study packet. NGN self-study gives you every single packet for every single playlist. That's the shit. And it's very affordable. So if you click on my link or you tell me you want that, you know, you call me at this number, 216, text me. I ain't gonna answer your phone call. 216-410-0936. If you text that number and say, I want the self-study, I want the 6 for 66, boom. Now, some of y'all already know we had 7 for 77. Maybe you want that, even though it's after the first of the year. I'm just saying, whatever you want, girl, call me. Call me. Okay, here we go. Listen. Handouts and resources. Let's say you can't afford none of this shit. I'm all right with that. I'm cool with that. You might want to get the Oh My God packet, but you can't really afford none of this shit. You didn't spend too much damn money anyway. A lot of students I talked to spent a lot of money. What should you do? You should just say to yourself, I'm still going to pass. Shelly said this test is mine. Get you a 5-subject notebook and organize your shit just like that. When you get the UWorld software at the bottom of the question, it tells you what category it goes in. Make sure you start categorizing some of your notes. My God, you could use these titles of these packets, make your own packet, boo. Do that. You ain't got no money. You ain't got no choice. But then, no, you might have to take a little longer studying, okay? So that's it. Now, number 4, I said 5 quick tips. You with me? You still with me? You hit subscribe, didn't you? Come on. Number 4, know your personal risk factors. See, if you just graduated, you don't work, you live with your parents, you have no children, you are the shit and gonna be gone in about 15 minutes. In other words, you are not gonna take 2 years, 4 days, and 8 months to learn this shit, right? Oh, and I forgot, if you went to a good school, because none of that matters if you went to a shitty school. But if you went to a good school, you live with your parents, you have no kids, you do not work, you're not gonna be long at all. You don't even need a lot of packaging and resources and things. You just need to sit down, do some of these UWorld questions, look at these videos, have a system, which I'm going to share with you in a minute, and do the damn thing. But that's not typical. Yours truly had a kid, dropped out of high school, was sitting up there getting her head banged by baby daddy. I was intelligent, but I went to a good school. I had that going for me. But I had a lot of obstacles because I worked about 40 to 50 hours a week. So I feel that. I mean, I had to. I couldn't even get a dime from my family, okay? They was like, you made your bed, lie in it. I said, oh, it's like that? I can't even get bus fare out, y'all? Okay. I didn't have no car. I had 3 buses. I caught 3 buses a day. That's why I ain't trying to play with y'all. I already know what it is. I've been there, done that, T-shirt, sun visor. You might know my glory, but you don't know my story. But that's what I did, and you can do it too. But you got to be reasonable with this. Here we go. If your risk factors include you were born outside of the United States and you were here less than 7 years, you have a almost an 85% chance of failing. The key is how long have you been in the U.S.? Have you been here 7 years or more? Because this is my PhD. I specialize in international students. If you've been here 7 years or more, then the risk of failing goes down to about 51%. But that's a high-ass risk of failing. What am I saying? I'm saying that if you were born in the United States, born in the USA, took this test, your passage rate is 79%. If you were born outside of the United States, took this test, your passage rate is 46, 47, 48, 49%. It is what it is. It's a risk factor. It's one of the biggest, okay? Here's one. You failed more than 2 times. Back the fuck up. If you failed more than 2 times, you need to back up. Slow down. Stop applying for that damn test 45 days later. Stop that. That's the worst thing you can do. Stop it. Back it up. Take your time. Be still. Learn this shit. Get it right. And I'm passionate about that because I talk to people every day. Every 45 days, they taking a test. No, it takes on average, if you're going to learn this the right way, it takes a good 6, 8 to 12 to 16 weeks for some of you to learn it. So stop it. Working more than 24 hours. You might be like me. You'd be like, Shelly, whatever, man. You talking to the wall because I ain't got no choice. I got to work. I just got off the phone with a dude who was in nursing school. He doing an LPN to RN program. He has 24 hours of class time online that he's got to be engaged, and he works 60 hours a week. If you add it, because I failed math, and I think I'm right, but I failed math, so you got to help me. That's 84 hours he's consumed. When the fuck is he going to study? Might not work out for him too well, but he heard me loud and clear. He got to back up off of something. If you can't do it, and he might can't either, I know I couldn't. If you cannot cut down your hours, then you sure better be realistic about how long it might take you to study for this test. Because one way or another, time is going to make you pay. If you want to work that many hours because of whatever reason, like me, I was a soul survivor, soul supporter, soul everything. This is what I did. If you gotta work that many hours, then don't be thinking you finna get this test figured out in 2 weeks. That would be stupid on your part. Okay, it means that you're going to be in class at your house a lot longer than some. Okay, baby. Now, here goes some more stuff. Maybe you went to a bad school. It really bothers me when I ask you, was your school good or bad? And you tell me, oh, it was good. Almost 100% of you say it was good. Every blue moon, I get somebody, honey, it was a horrible school. But what I have found out is when I Google your school, and I do, number one, the worst schools are in Florida. They either fake to start with, or they're just really poor quality schools. And then I think they have a scam going on. And this is my opinion. But my opinion tells me, after talking to all these thousands of students, that when you fail 3 times in Florida, that's fact. When you fail 3 times, your NCLEX 3 times in Florida, they make you take a remediation course for another additional $2,000. And that's a piece of shit too. So let me figure this out. If you failed your test that many times, you take remediation, pay $2,000 more, then keep failing. Wow. Is that working for you? Stop applying for your test in Florida. Apply for your test somewhere else. And stop being in Florida in the first place. You know they racist. Everybody know they racist. They took the Black history out the book, said slavery benefited us. The fuck out of Florida. I don't give a damn who you tell I said that, because I ain't got no fear. Bring it on. Okay? I ain't scared of shit. Okay. I don't know where that came from. But I'm mad. Can you tell I'm mad? Florida? Shit. Now, if you went to a bad school, you never learned this shit in the first place. You got to take your time, back it up, and learn it the first time the right way. Just saying. Might take you a little longer. If your personal risk factor is that you looked at that candidate report and you were like, oh my God, I have all these belows. I have some aboves, usually in case studies, but I got a bunch of belows. Well, then guess what? If you got more than 2 belows, you didn't learn a whole lot in school. You've got to back it up too and learn this the right way. Maybe you don't have that, but maybe, and honestly, if you failed at 85 questions, you got more than 2 belows already. So just in case you don't really notice the candidate report, maybe you did what my girl did today when she said she balled shit up and said, basketball. If you didn't get a chance to look at that, but you know damn well that they kicked your ass up out that test in 85 questions, guess what? You didn't learn nothing in school. It might be because the school has closed, they were so bad, or they're on probation, they sucked so bad, or they're about to get on probation because their passage rate is 12%. The other day, the passage rate for the school the girl gave me was 12%. Do you think she learned anything in a school in which only 12% of their students pass? Come on, y'all. I'm asking you to think about this. Okay, come on. Here we go. You need a system. Oh, yes. You need a system and a schedule. When I get up off of this video, I'm going to make a video about what that schedule is going to be. And we're going to show you what you should be doing and what week you should be doing it and how long it should take you and what you should do after that and how you get your shit together. But right now, this is part of the system. Here we go. Get a system. That's what the Oh My God packet does. It gives you a system. It's a freaking $35 packet. Now, if you don't know your risk factors and you already failed, you might need a consultation. Or if you don't, you didn't fail, but you just want to know how to do this, you too can have a $35 consultation. Did the price go up? Damn Skippy. It's a new year, baby. Welcome to 2024. Used to give this Oh My God away for free. Y'all got ridiculous with it. It's $25. Then new year, it's $35. Yeah, I already know the price went up. You ain't got to tell me I did it. Okay, so consults, $35. They are worth their weight in gold, but I'm just trying to tell you how to get organized. So if you look at the system, let's look at the system that you need. You need a system. This 2024 Ngn Nclex update video has got me wanting to make sure that you know, look at this. It's a shocker. Come on, stay with me. Here you go. Spend less time on case studies. More on medications, infectious diseases, that sort of thing. Because here's what we did. We got scared out of our mind about them case studies, didn't we, y'all? And we started pounding them case studies like we had never pounded nothing before. Y'all doing good on case studies and forgetting the basics. So when you get a candidate report, you look at the bottom, you're like, oh, there goes some aboves. And everything above it is below or near. And this near thing, you know how you say near? Near is failing. Stop telling me you almost passed. No, honey, you ain't almost passed unless you got all aboves and a below, or all aboves and a few nears. Nah, near is not near passing like you think. Aboves on that paper is passing with flying colors, okay? So stop spending time on case studies. What I have found out is that you put all your focus on case studies, and guess what? That was good because you didn't know what to expect, but now I'm telling you, 2024 Ngn Nclex update, stay the fuck away from them case studies after you look at them for a few times. Follow a couple of my videos with Grey's Anatomy case study. Boom, that's enough. Stop it. Ooh, focus on meds, okay? Then here's the thing. If you are blessed and you live by yourself, if you live with your parents, you're a brand new graduate, you just went to a good school, you don't have to work, or maybe mom and dad told you you didn't have to work, but you worked anyway, sit your ass down. What you need to do, the new graduate, just like that, you are so blessed. Here's what I want you to do, new graduate. You need to master 2 subjects a week. We go by subject. When the next video comes out, right after this one today, you will see what subjects to go in order with, what subjects are major important. There's been a change on that too. Which subjects are important, but you don't need an 80 or 85% in them. All of this is what I'm telling you to get you a system. If you are somebody who doesn't live with their parents, who does work, who does have children, a baby daddy, and a flavor of the month on the side, and got to cook for mama and them, and auntie got to go and do whatever, and grandma live with you, and all the shit that we got to deal with. Your system is even more important than the new grad because you don't have to play. You don't have any time to play with. You've got to focus on how to structurally, systematically, and excellently get this done and learned, not memorized. You can't memorize this. You can't flashcard everything. In fact, the only thing that flashcards make sense for, there's 3 things that flashcards make sense for. Medications, of course, infectious diseases and their precautions on the back, and then your EKGs. That's it. Everything else, you kind of got to learn it. Now, I pray that this was helpful. If you want the 6 for 66, then go ahead and text me 210-410-0936. Yeah, don't email me. It's never going to get answered. Sometimes I see them, sometimes I don't. It's the last on my list. My text messages take priority. Please allow a few days for this. I do work. Y'all think I'm over here just singing videos all day? No, I work at a hospital. I can't even get to you if I'm in the hospital because I'm in the OR doing whatever. So give me a few days. Patience is a virtue. Please, y'all. Now, last thing I want to say before I deuce this out of here, please consider rescheduling your date if this video hit home and you found that maybe you share some of these really high-risk situations. Don't be afraid to reschedule your test. You don't get in trouble for it. You don't have to pay to reschedule. You can reschedule your test 7,000 times. Look at your ATT, find out when that expiration date is, and then give it your all and go take your test like the week before the expiration date. This is good advice for most students. I love you. Happy New Year. This has been the 2024 Ngn Nclex updates. Again, reduction of risk, basic care and comfort, high failure areas, more medications than you've ever seen, and the 5 tips include get really excellent software, which I consider URN, not Archer. Get on YouTube. It's a great resource because some of your schools didn't even teach you. They made you teach yourself. So go ahead, get on YouTube, find the HETV channel, and there are a few good others. I said it in the video. Take your notes. Don't just look at the video. Take the notes. Focus on the meds. Get your handouts and your resources. We have everything you need. You might need a discount. If you don't have the handouts and the different resources, that's okay, sweetheart. Get you a 5-subject notebook. You still gonna pass this test. This test is easier. Did I say that? I'm saying it again. It's easier. So just go ahead and get your 5-subject notebook. Know your personal risk factors. Know who you are to this test. Know that if you've taken this test, oh, let me say something real quick. Oh, no. I have people that take the test 3, 4, 5, 10, 11, 12 times. Here's why it's harder. It's harder. Here's the deal, guys. When you take the NCLEX, it's all the questions that you get are coming from a test bank. So let's say that you took this test 4 times. 1, 2, 3, 4. You took it 4 times. Let's say you are that nurse. You had 150 questions the last test, 120 one other test, 85 the first, and whatever else. If you think about just those numbers of questions, you've used all those questions up. Now they've got to reach in their test bank and pull out questions that you've never seen before, which inevitably are harder. That's why we say the more you take it, the more you fail. So stop and just back up and learn it right the first time. Okay? If you are a new grad, this is words of wisdom. You don't want to take it more than once. That's it. Okay? So again, number 4 is know your personal risk factors. And number 5, get a system, a schedule on how to approach this. It's a new year. You've had your holiday. When I get off this video, I'm going to make a new one. It's going to have a system and a schedule and how you tackle this test. And then you can go ahead and say, Monday, it's me and you, NCLEX. Let's do this. Let's blow this popsicle stand. Make NCLEX your bitch. Deuces.